So, hello everyone. Welcome to all the viewers. The INI CET November 2021 results are out, and I have with me a topper. In fact, a very good rank holder, rank 39 in the November INI CET exam, Dr. Sushain. So, hearty congratulations and welcome, Dr. Sushain.
Thank you so much, sir. First of all, very good afternoon to you.
Okay. Yeah, Sushain, so I'm sure that you must be very much relieved after the exam results. But let me ask you, yesterday the results were supposed to come, and
Yes,
were you a bit anxious or were you cool enough expecting a top rank?
No, sir, I was very anxious.
Okay. So, Sushain, first of all, for the viewers,
yes,
who are maybe we have in the viewers students who are preparing for the upcoming NEET PG 2022, INICET, even MBBS students who are targeting the next exam will be listening to you. So they are waiting for your inputs. Let me begin by asking you about INICET. So how was the INICET exam questions this time? Was it according to the pattern that you expected?
the pattern was somewhat similar to the previous July INICET exam, but the levels of question was slightly tougher than the previous exam, and I found it slightly tough than
Okay.
the previous
I
one.
think many of the students had this same opinion, slightly tougher than the previous INICET. But let me tell all the viewers that Sushain is somebody who is very much dedicated, because can you just go through your ranks in the previous INICET, Sushain?
Yes, sir. My first entrance exam was last year, November INICET exam. I secured a rank of 3,520. Then my second exam was the July INICET, and in that I secured a rank of 556.
Okay.
Then I gave the NEET PG 2021. I had a rank of 988, and
Okay.
this was my third INICET exam, and I secured a rank of 39.
Yeah. But I think, you were reasonably expecting a good rank in the previous INICET also, because I remember after the exam, you were messaging me regarding the approximate number of right answers. So at that time, what was the mindset? Were you prepared enough? And what was your reaction after the results then?
Sir, I watched the recall sessions after the July INICET exam, and I was expecting around correct questions around 140, 145, and they were almost around same correct. And but I had done many silly mistakes in that exam.
Now, this time, did you have go through the, recalls and approximately how many you got right and how many did you attempt?
Sir, I attempted 194 questions, and according to recalls, I had correct around 150.
Okay, around 150 correct, which is pretty good because the exam questions were slightly on the tougher side. All right. Now, see, if you just break these questions of INICET, how do you see the pattern of questions? Were they more factual or were they linking multiple subjects together?
Sir, it was a mixture. Many questions were straightforward one-liner questions, but many questions were integrated questions from the second prof subjects and the final year subjects.
Okay, all right. Okay, so out of these, subjects, in which subject you felt, you did your best?
Sir, surgery and gynae.
Guy, all right. So your rank is 39 now. Which subject are you planning to take for your post-graduation?
Sir, medicine.
Medicine, great. So, you got a rank of around 988 for NEET PG.
Yes, sir.
You would have got medicine at that rank. So why did you decide to proceed ahead? Many of them would have been contented with the rank and have stopped studying. But why did you proceed ahead?
Sir, obviously everyone knows that Aims and PGI like institutes are the apex in the country. So I thought I have a chance, and counseling is also delayed due to the counseling case in Supreme Court. So I decided to give it a one more chance.
Okay, that's good. And I think, that was a very good decision also right now, because you've got a very good rank 39, and definitely you're going to study in the topmost institution. So what is going to be your preference as of now in your mind?
Sir, institute.
Yeah, institute.
Sir, Aims Delhi, followed by PGI Chennai.
Okay, all right, fine, good. And then tell us, for the MBBS students who are listening to you, okay, maybe a first year student or second year student. So they are hearing about all these uncertainties about next. As a senior, from your perspective, what advice you want to give to your juniors, whether entrance preparation is possible during the academics prof exams, or is it a totally separate style? What do you want to say to the juniors?
Sir, I like to say that basic concepts are same, whether it is for the prof examinations or for the entrance examinations. The first prof and the second prof subjects form the base, and without knowing these subjects, we can't answer integrated questions at all. We have, for example, there were many cadaveric images in this INICET exam. So without knowing anatomy, we couldn't have answered that questions.
Yeah.
So basic subjects are very important. First prof and second prof subjects.
And I think, there were questions which were linking subjects also. Like, say there was a question on the drug interaction between phenytoin and sucralfate.
Yes, sir.
So basically, slightly unconventional, because otherwise pharmacology questions would be integrated to a direct clinical scenario. But here they are trying to see if you know regarding, because phenytoin definitely is a drug that is used in neurology, but they want you to understand, okay, about the drug interaction of phenytoin with sucralfate. So were you surprised seeing a few questions like that, or was it expected?
Yes, sir. Few questions like these, and two, three questions about simple. They had asked about facts in medicine, like percentages of death in heart failure, or the other one like EEG question,
Yeah,
epilepsy one.
question on EG. So a few questions were there that were slightly on the tougher side for medicine, but otherwise, I think more or less expected questions. All
Yes,
right.
sir.
Okay, fine. And what about the DocTutorials QRP sessions, the quick revision program sessions that were conducted? So you had attended those sessions. So how did those sessions benefit you?
Sir, that was very helpful. I watched those sessions before the July INICET, and every faculty discussed 20 questions in a video, and I remember watching most of the videos, and these were very helpful in clearing my doubts, and the questions were very integrated in those videos. They were very helpful.
Okay. And you are actually in touch with the faculties also through the various Telegram groups. We had just spoken that you are there in all the DocTutorials faculties Telegram groups.
Yes, sir.
That I'm, my Telegram group, all the faculties Telegram group, you are there. So just tell us this also, like uh, regarding the NEET exam. See, many students listening to you will be preparing for NEET PG 2022. So some of them would not have fared well in the INICET. So with the time remaining to NEET PG 2022, which is supposedly to be on March. So what advice you want to give them? Like if you were in their place, how would you strategize your preparation leading to NEET PG 2022?
Yes, sir. So three things are most important for the any entrance exam preparation. First is your notes, second is the question bank, and third is the grand test. I used to give two grand tests per month since November last year, and question bank at least 100 questions per day, and notes. So I used to revise for almost 80% of the time notes and 20% questions.
Okay. Just want to ask you another thing, like they say that, toppers study a lot. So, how many hours a day do you put for your studies?
Sir, post internship, usually 8 to 10 hours a day.
Okay, 8 to 10 hours a day. So, did you avoid all distractions like social media during the
Yes, sir,
time?
yes, sir. I used only Telegram and WhatsApp. Rest all social media was off for 2 years.
All right, all right. So, you wrote the INICET exam, and let me ask regarding my subject, medicine.
Okay.
So, out of all the medicine topics, if you compare the last two INICETs, with the previous Aims exam. So how do you see the weightage of questions regarding, say, cardiology, nephrology, neurology? In which topics more questions come from?
Sir, cardiology was the bulk even in NEET, recent NEET exam and also this INICET, followed by neurology.
Yeah. So probably, I think previously, when Aims used to conduct the exams for Aims alone, it was mostly cardiology and endocrinology, which was forming the peak of medicine questions. In fact, nephro and neuro, followed by nephro and neuro. But now probably NIMHANS is also included in this, which is why, they are putting questions with respect to the neurology part as well, which is why, some EEG question also came, testing your knowledge on EEG. There was a question, in fact, asking you on whether, just testing you whether you know the basics of EEG, whether you can pick up a frontal lobe epilepsy easily on an EEG. So those questions, probably because NIMHANS is also included, that's why the weightage of neurology has gone up. Now, again, coming to the preclinical and paraclinical. So in INI CET, what do you think about the weightage of these subjects?
Sir, there were approximately extra weightage given to anatomy. There were around 11 to 12 questions, out of which 3 or 4 were cadaveric images. And microbiology was also, many questions were there in microbiology. As well as,
even in these the QRP sessions also, for anatomy, Azam sir had done a detailed session for the quick revision, and Dr. Mamta Java also had done a detailed session for microbiology QRP. You watched all those sessions?
Yes, sir. Yes, sir. I even watched Sandeep sir's and Mamta ma'am's recall videos after the INICET.
All right, all right. So, what is your final message, for the aspirants? You have already told them regarding your preparation style, but again, for the students who might be confused and self-doubting their abilities, because even yesterday after the results were published, many students were having this doubt. I prepared for previous ICT, my rank is so and so, I have not made a big improvement. So for those students, what advice you want to give them?
Sir, I likely advise that one must avoid silly mistakes, but silly mistakes are one. I had also done 3-4 silly mistakes in this exam also. And in last 15 days, one should revise the volatile points. I had made a list of volatile points in every subject in the last page of my notes. So in the last 15 or 20 days, I used to revise these topics only. That helped me to revise faster.
Yeah, this is a very, very important point, I think, because even yesterday, one student actually messaged me. The previous INI CET also, the particular student was preparing reasonably well, but the last 2 to 3 weeks, somehow he was not finding it, easy to, look which subject to learn, what to revise, was confused. So I think you said a very valid point. Whatever small notes that you had made for the final round revision, you were sticking to that rather than going for any new resources. So that actually, I think, builds the confidence also leading ahead to the exams. Correct, Sushain?
Yes, sir.
All right. So thank you so much, Sushain, for joining and sharing your experiences, and all the best. May you be a very good physician. You're going to take medicine. All the best, and stay in touch with all of us. Okay. All right. So thank you so much, Sushain, for joining.
Thank you, sir. Thank you. Thank you so much.